to the point earlier in this discussion, the efforts for prevention, for screenings that do not require copayments or deductibles, the annual checkups, these are all elements that were introduced, embedded into our reform package to contain costs, to bend that cost curve. The real concern that so many have raised from the Democratic membership in this House is that we're not providing the sorts of savings for our seniors. We're not bending that cost curve. When you send them out to shop and don't even give them adequate coverage, 32 cents, and then the indexing into the future is not keeping pace with the projected inflation of healthcare costs, we're putting them at risk. We're targeting them for defeat. And they're saying, well, you're going to have 13 or 15 plans from which to choose as you shop in the open market. Well, that isn't bending the cost curve. And so the economic consequences here are, first and foremost, the hardship that seniors will have to embrace, they'll have to endure. But then also, when we look back at 1966 and 65, the available cash, the economic vitality of a senior household was drained. It went south because medical costs were usurping their retirement funds. Think of it. Those dollars not only help provide stability and security for our nation's seniors, but that's available cash that they can use to perhaps have a meal out at a restaurant in their local community. There are dollars made available that get spun into the regional economy that allows for the comeback. So this is very interesting. The programs, the cuts that they're suggesting are all in areas that can help create jobs and improve economic viability.
And, one example I can share with you, we had a town hall meeting in my district talking about the Medicare program. We had Dr. Rebecca Andrews, primary care doc at the University of Connecticut Health Center, and she was talking about the new annual screening coverage, where she had a guy, one of her patients who was kind of a big, husky guy, kind of, they used to kind of razz each other, but she had him 45 minutes with him. She did the soup to nuts checkup. She ordered a urine test, which she normally wouldn't with the old system. She found a tiny microscopic speck of blood, or they did at the lab, which they were a little concerned about, called him back in, did a follow-up, and it turned out he had bladder cancer. And because they were able to detect it so quickly, because of that annual checkup and the cancer screening tests that are now covered under Medicare, it was a day surgery in and out, really very non-intrusive event that cost a fraction of what it would have been if he had not had that checkup to detect that cancer early. And she had at least 2 other patients, because of the new Affordable Care Act annual checkup, where they detected cancer, and again, were able to intervene at a low cost compared to what would have been if it had been a full-blown case.
And Representative Courtney, I think what we're talking about here is legitimate reform in a way that bends that cost curve and takes a sound economic program like Medicare for our nation's seniors and allows for that benefit of pooled resources from coast to coast to serve our nation's seniors well. But the concern here is, Representative Garamendi, they want to give their friends with deep pockets more opportunity for business. End Medicare to provide more business for the private sector insurance industry.
If I might just
privatize Social Security, right? To give business to the big banks.
It's another bill they've introduced.
So I think you have a chart there that talks about another special interest